Alright, let's dive into something that's both fascinating and a little alarming. Here's the deal. A recent study found that older adults taking 5 or more prescription drugs face a significantly higher risk of death. But before you panic and start tossing your meds, let's break this down and think about what it really means. First off, what makes this really interesting is the concept of polypharmacy. That's the medical term for taking 5 or more daily prescriptions. It's not just about the number of pills. It's about the complex web of interactions and side effects that come with juggling multiple medications. Personally, I think this study shines a light on a bigger issue. As we age, our bodies become more vulnerable, and the very things meant to help us, medications, can sometimes do more harm than good. Now, let's talk numbers. The study, led by Dr. Alexander Chaitov, tracked nearly 8,000 adults aged 65 and older over almost a decade. Here's where it gets eye-opening. After accounting for overall health, taking 5 or more prescriptions was linked to a 38% increase in mortality risk. And for every additional medication, that risk jumped by another 7%. That's not just a statistic, it's a wake-up call. But here's the thing, it's not as simple as medications kill. What many people don't realize is that older adults taking multiple drugs often have multiple health conditions. So, is it the medications themselves that are the problem, or the underlying health issues? From my perspective, it's a bit of both. Medications can interact in unpredictable ways, especially as our organs age and process drugs less efficiently. This raises a deeper question. Are we over-medicating, or are we just treating the symptoms of a larger, systemic issue in healthcare? One detail I find fascinating is the idea of deprescribing, carefully reducing or stopping unnecessary medications. This study suggests that for some patients, less might actually be more. But here's the catch, it's not a one-size-fits-all solution. As Katie Dubinsky, a pharmacist, pointed out, you shouldn't stop taking your meds based on this study alone. Instead, it's about having an honest conversation with your doctor or pharmacist. Ask why you're taking each medication, whether it's still needed, and if the dose is appropriate. If you take a step back and think about it, this study isn't just about mortality rates, it's about quality of life. Are we trading one problem for another? Are we extending life at the cost of living well? Personally, I think this is where the real conversation needs to happen. We're living longer, but are we living better? And let's not forget the limitations of the study. It focused only on older adults living independently, not those in nursing homes. Plus, it only looked at a 30-day snapshot of medication use. That means we are missing the full picture of how prescriptions change over time. So, while the findings are compelling, they're not the whole story. Here's my takeaway, this study isn't a reason to fear medications, but it is a reason to be proactive. If you or someone you love is taking multiple prescriptions, don't just accept it as the norm. Question it. Understand it. And work with your healthcare provider to find the right balance. So, what do you think? Is this a sign that we need to rethink how we approach medication in older adults? Or is it just a reminder to be more vigilant? Let me know in the comments, I'd love to hear your thoughts.